Hi, I am Dr. Muralidhar Kathalagiri. I am a consultant, robotic, laparoscopic, bariatric and gastrointestinal surgeon. The hernia surgery has gone tremendous advancement in the last 2 to 3 decades. About 3 decades back came the laparoscopic or the keyhole surgery, which changed the way any abdominal surgery including hernia surgery is performed, and the surgeries became so much less painful and much earlier recovery. With the advent of robotic surgery in the last 1.5 decades or 2 decades, this surgery has become even better, even more refined, especially whenever we are handling complex surgical or hernias. In those situations, robotic has a very big role to play and makes the surgery much simpler for the surgeon and recovery much faster for the patient with much less pain. So yes, robotic and laparoscopic surgery has made big difference in a way a hernia surgery is performed. Robotic assisted surgery is one of the latest methods of treating any abdominal surgeries including hernia surgery. Now there are multiple robotic systems that are available. Generally there are the patient side cart or the instruments, and these instruments are fixed to the patient's abdomen at specific places based on that particular disease or the hernia, and those robots are controlled with much higher precision by the surgeon, the operating surgeon, at the console. So the robotic assisted surgeries are performed by the surgeon and not by the robot. That is point number 1. And 2, it is one of the newer formats wherein the instruments move much more or much better than laparoscopic surgery or open surgery. So with a better vision, with better precision, we are able to give much better quality surgeries for the patient with robotic assisted surgeries. The minimally invasive surgery, including the robotic surgery, the scars are much smaller. The incisions are much smaller. It will be about 5 mm, 8 mm or 1 centimeter or sometimes a little bigger than that for the specific ports or the instruments for passing through the abdominal wall for doing the surgery. So the scars will be definitely much smaller. So it is definitely cosmetic. And because of the precision that we are able to achieve with robotic assisted surgery, the dissection is much more precise because of better vision and better equipments. And as we are able to do the dissection with much precision, the pain, the inflammation at the operative site is so much lesser. So because of this, we are able to do the surgery with much less pain, with much more precision to give the better result for the patient. Robotics assisted surgery is definitely safer for older patients, but we always assess if the patient is too frail or too weak, then we will modify our surgical techniques. But old age does not mean that they are unfit. We always assess the patient's fitness based on their parameters and decide what format of surgery to do. So yes, old age does not contraindicate a robotic surgery. The major advantage of robotic assisted surgery is much faster recovery. And because we are able to achieve much faster recovery, they are able to get back to their physical activities in a few days to a few weeks. And so is it with sexual activity. So it is recommended that they avoid it for a week or 2, and then gradually they can get back to their normal physical activities.